Hi everyone, and welcome to today's webinar, Tips for Evaluating a Colorectal Cancer Screening Social Media Campaign. My name is Tamar Wallace, and I'm the co-chair of the National Colorectal Cancer Roundtable's Task Group on Evidence-Based Education and Outreach, along with my colleague Andy Dwyer. Thank you everyone for joining today. We have a lot of interest in this topic and really appreciate your taking the time to join us. As you may know, as part of the Roundtable's effort to achieve 80% colon cancer screening rate by 2018, we've been promoting new tested messages that are available in our new resource called Communications Guidebook, Effective Messaging to Reach the Unscreened. And now, thanks to our colleagues at George Washington, we also have access to social media messages that are based on these previously tested messages. And as we all know, social media offers us an exciting platform to promote colon cancer screening to a diverse audience, but because it's a little bit of a newer medium, some of us have a lot of questions about how to evaluate the impact of those social media campaigns. We're trying to figure out how we know it's getting where we want it to get and doing what we want it to do. So that's the purpose of today's webinar. We're going to address and review how we might evaluate a social media campaign using the 7 steps to evaluation. And those 7 steps are outlined in our Roundtable's Evaluation Toolkit, which was developed in partnership with Wilder Research. So just a little bit more detail on today's presentation. We will provide an example of a social media campaign focused on colon cancer screening, and we'll discuss what an evaluation of this type of campaign entails, highlight tools available to assist with the evaluation in the area of social media, and also discuss some of the unique challenges in evaluating the impact of social media. So with that focus in mind, today we're very fortunate to be joined by 2 expert speakers who will be presenting on today's call. Our first speaker will be Cheryl Holm-Hansen, who is Senior Research Manager at Wilder Research. And again, she partnered with the Roundtable to create the Evaluation Toolkit, so she's literally written the book. Cheryl will provide an overview of the Evaluation Toolkit, including those 7 steps to evaluation and some tips for social media evaluation. And our second speaker will be Kaneko Kashima. Kaneko is the research assistant at George Washington University Cancer Institute. And Kaneko will speak about what social media is, why we should consider using it, and how to evaluate a social media campaign using those 7 steps of evaluation. And also joining us, just in case she decides to pop in, is Mary Doroshenk, as always, the director of the National Colorectal Cancer Roundtable. So just a few housekeeping items before we get started. Today's webinar will be recorded. You'll have a link to the replay and the speaker slides within a few days. So if you'll have that resource to go back to even after the live webinar ends. And because we have so many participants on today's call, all the participants will be muted, but feel free to submit your questions through the webinar's Q&A function, and make sure to submit it to all panelists so that we can see the questions. And then we'll answer the questions after the presentations are finished, and we will take as many as we can. If we do have more questions than we have time for, we will definitely get back to you with the answers to those questions after the webinar, so you'll definitely get an answer. Also after the webinar, we want to walk the evaluation walk as well as talk the evaluation talk. So we will be sending you a survey to help us evaluate the webinar and what you found useful and what we can improve upon. And finally, this webinar is part of a series we're doing on evaluation, so we hope you'll join us for the next one, which will be on September 21st, which is a Monday, at 1 o'clock Eastern Time, and the topic will be evaluating systems change focused on colon cancer screening. So let's see, with that, I'm pleased to turn the webinar over to Cheryl Holm-Hansen, who will give us an overview of the Evaluation Toolkit and the 7 steps to evaluation. Cheryl?
Great. Thanks, Tamar. The screen in front of you has a picture of the toolkit, and as Tamar mentioned, we developed this a few years ago and have been updating it on a regular basis, and it can be accessed at the site referenced on the toolkit as well. And what I'm going to do is just give you a very brief overview. It's a pretty dense toolkit with a lot of good resources and materials in it, and we're going to just talk about the 5-minute version of the toolkit. Next slide, please. The toolkit provides a general overview of the evaluation process tailored specifically to the context of colorectal cancer screening initiatives. And it includes not only an overview of what evaluation is and the 7 steps to conducting evaluation, but it does also have a number of additional resources and materials within the toolkit itself. There's an extensive appendix that includes a variety of tip sheets, sample data collection materials, worksheets, and other resources. There are some materials that have been translated into Spanish as a starting point for programs serving that population. And there's just a lot of samples and examples in there for you to work with. We are in the process right now of updating the toolkit, and there will be a new edition released in the fall of this year. And related specifically to this webinar, the new version will include some additional resources related to social media initiatives and how to evaluate them. It will also include a case study based on the example that Kanako will be walking us through shortly. And in addition, the updated version of the toolkit will also include a deeper emphasis on policy and systems approaches to promoting colorectal cancer screening, and several other case studies highlighting how different initiatives have been evaluated. Next slide, please. This graphic summarizes the 7 steps to evaluation that are the basis of this toolkit. There are other evaluation models and frameworks, but they all have basically the same kinds of steps. And I'm just going to spend a minute or two talking about each of the 7 steps. Kanako is going to be going through her example of an initiative using social media, and her example will be aligned with these 7 steps, so you'll be able to see them in practice as she does her part of the presentation. The cycle of evaluation, first you'll see that it's intentionally a circle and not a linear process. Evaluation is meant to be ongoing and dynamic. And as you finish an evaluation cycle, you may have new questions that you want to answer or have learned things that you want to explore in a different way or more deeply. So it is a circle. I'm going to start at the top, describe and map your program, which is our first step. And at this step, we really recommend taking some time to think about what is your program, what's your initiative about, what are your core strategies, and how do they align with the specific outcomes that you're hoping to accomplish through your program. The toolkit provides some deeper examples around creating a program theory and a logic model to show that alignment between what you do and what you're hoping the impact will be. The second step is to prioritize what you need to know, prioritizing your evaluation questions. As you design the evaluation, you'll want to make sure that your data collection strategies are focused on answering the things that are really the most important for you to learn. The toolkit talks about several different types of evaluation questions that you may have. Often you'll have questions about the outcomes or impact of a program on a set of participants or on a broader community. You may also have process evaluation questions, which focus on critical aspects of how a program is being implemented. And you may also be interested in assessing things like satisfaction with a program. In this second step, you consider all the possible questions you have and prioritize those that are the most important for you to examine through your evaluation. Step 3 is designing your evaluation. The toolkit talks about a number of different strategies that you could embed into an evaluation design. Some evaluations rely primarily on existing data, such as public health data sets or information from electronic medical records. Other evaluations will require new information to be collected. The toolkit talks about a number of different data collection strategies that can be used, such as surveys or interviews or focus groups. The strategies all have different advantages and disadvantages. There's really no one best method to use. The toolkit talks in some detail about the pros and cons of different ways of gathering data and recommendations for choosing the approach that best aligns with your evaluation needs and with your available resources. The fourth step is to create the tools that you'll need for information gathering. Again, the toolkit provides recommendations for writing good survey questions, how to design interviews, how to create focus group protocols, how to figure out what to pull out of existing data sets, and all of that is in there in some detail. Once you've created your materials, you'll move to step 5, which is collecting the information, carrying out whatever your data collection strategies are. Stages 6 and 7 are the things that you do once you've gathered the information. Certainly you need to organize your information and analyze it. The approach that you use will depend on whether you're gathering numerical data or whether you're getting more verbal type information through a focus group or an in-depth interview. But for sure you'll need to organize it, summarize it, and figure out what you've learned from the evaluation. The 7th step is in many ways the most important, which is using and sharing the information. We believe strongly at Wilder Research and with our work with the Roundtable that evaluation shouldn't be something that you invest time and resources into just to have it sit on a shelf. We know that some programs have requirements to conduct evaluation, but really what you want is some information that you can act on at the end. You'll want to look at the information, see what the most important pieces are, and find ways to use the results to make a program approach more effective or more efficient, or to increase the satisfaction of your key stakeholders with your services, or to reduce some of the implementation challenges that you may experience. We also emphasize in the toolkit the importance of sharing the information through a variety of resources. That could be formally publishing, but it could also be informal conversations with others or presenting at local or national conferences. We believe that as you share the information, we all learn more about the most promising approaches for increasing colorectal cancer screening. And again, then as you reach step 7, we come back to the beginning of the cycle again, and hopefully through the evaluation you've learned some things. Maybe you'll take some action based on those results and then repeat the cycle to see whether those actions have led to the changes in outcomes or efficiency that you were hoping to achieve. Obviously, evaluation is a much more complex process, and we're going through it very quickly, but that's just the general overview of what evaluation looks like and what the processes are. And with that, I'm going to turn it over to Kanako, who's going to walk through those steps in more detail with a specific focus on social media.
Thank you so much, Cheryl, for that wonderful overview of the 7 steps. As mentioned, I will be applying some of those steps to social media specifically. So by the end of the presentation, you will be able to answer the following questions. What is social media? Why use it? How is social media useful for public health? How can we measure social media efforts, which will be the main focus of the presentation? What are some challenges and solutions to social media evaluation? And what social media resources exist to help you get started? So to quickly overview the definition, this is from Bentola. He says that social media are internet-based tools that allow individuals and communities to gather and communicate, to share information, ideas, personal messages, images, and other content, and in some cases to collaborate with other users in real time. And I would emphasize the last little phrase right there with the collaboration and engagement, which is what makes social media unique. So why use social media? This chart from the Centers for Disease Control and Prevention shows how we have progressed from traditional media such as newspapers, TV, radio, and billboards, more and more to new media such as social media. I would argue that the section that says 5 years from now is where we already are today. The other reason for health professionals to use social media is it provides a great opportunity for us to correct misinformation that is out there and disseminate evidence-based health information. The upside of social media is that, yes, it gives all of us a soapbox to communicate with each other, but the downside is the same thing. It gives everybody the opportunity to say whatever they want, whether it's evidence-based or not. And so our role as health professionals is to make sure that correct information is getting disseminated and that we're able to bust myths and make sure that the misinformation that are out there are corrected. Who uses social media? So this from Pew Research Center really shows the great reach that social media has. Between gender and sex, there's no real discrepancy. Yes, women use it slightly more. And unsurprisingly, younger generations use social media more, but older adults' use of social media is also rapidly growing, so it's a space that we should be watching out for. And the great thing about social media is that it reaches people regardless of education or income, as you can see from the bottom part of the slide here. This is a great graph from Pew again. I think it's interesting that MySpace is on there because personally I haven't heard of MySpace in a very long time. But this is from 2010, which isn't that long ago, which again shows you how rapidly the sphere of social media is growing. But this is also nice to see what age ranges use what platforms of social media. So this way you can target your population and decide on what platforms you might want to use depending on the population you want to reach. So for example, if you're trying to reach a more senior population to try and get them to do colorectal cancer screening, for example, Facebook might be the best option for you, or LinkedIn. But Twitter might be best if you want to promote HPV vaccinations among younger adults and adolescents. So again, I will be using the 7 steps that Cheryl overviewed in the previous part of the presentation to apply to a national colorectal cancer campaign that you might use using social media. So let's look at a case study. We'll follow this specific case study throughout the presentation so you can see what kinds of evaluation, planning, and tracking you can take on as a part of your campaign. So let's say you're part of a comprehensive cancer control program with the objective of increasing colorectal cancer screening rates by 80% by 2018. After conducting a literature review, you might find that an audience of newly insured individuals is empowered by the Affordable Care Act or Medicaid expansion and need to be motivated to get screened through and increase education on screening options, and get encouraged about taking advantage of the new insurance plans to detect or prevent colorectal cancer. So you decide as a team that you want to target 50 to 64-year-olds that are recommended to receive colorectal cancer screening. You don't have a large budget or extra staff capacity, so you consider social media to use as a campaign. Because according to Pew Research, 63% of individuals in the U.S. in that age range uses Facebook. So you might want to look at that as a part of your campaign. So you might come up with some sort of messaging that says something like, getting screened for colorectal cancer doesn't have to break the bank. Most insurance plans and Medicare help pay for colorectal cancer screening for people aged 50 or older. Find out more. And the link might take users to a CDC website on Medicare coverage for screening services. You can come up with a series of similar action-oriented messages targeted to the specific population and plan to push them out through Facebook throughout the month of March for Colorectal Cancer Awareness Month. And by the way, this message is evidence-based and developed on audience research conducted by the National Colorectal Cancer Roundtable. And you can see their colorectal cancer communications guidebook that is available going to the link on this site. It's tinyurl.com/NCCRT Communication Guidebook. So when you decide to implement an activity to advance your program objectives, you need to know what you're going to do, what to expect that will happen, how it should lead to intended audiences or benefits in a clear and concise manner. This is called program theory, and it needs to be solidified to know what you want and can measure. So as you develop your program theory, select one of your activities and answer the following 3 questions. If the activity is provided, then what, realistically, should be the results for participants? Why do you believe the activity will lead to this result? And what evidence do you have that the activity will lead to this result? Note here that a communication campaign alone, including social media campaigns, will not likely lead to sustained behavior change without additional approaches, such as TV or radio ads, snail mail postcards, and reinforcement of other approaches. After all, behavior change is a complex issue. For example, your campaign might result in an uptick in calls for screening appointments, but outcomes will be stronger if paired with support for a larger program for change, including components addressing healthcare services, technology, and changes in regulation and policy.
Kanako, this is Cheryl. If I could just jump in here, I just wanted to reiterate the importance of that point. As people look at ways of exploring the use of social media within programs and how to integrate it, it's really important to understand the role that social media will play within your initiative and what your expectations are around the outcomes of that activity. If it's your main focus, or is it an add-on strategy that supplements something else that you're doing. As you think about evaluation work, it's really important to be clear about what's reasonable to expect and how that message promotes whatever outcomes you're looking for, especially if social media is your primary approach. So I think you got that really right, and that's an important thing for anyone who's thinking about social media to be thinking about as you design it, and thinking about what are you doing through social media, what are your goals, and what are the hoped for outcomes.
Great, thanks, Cheryl. So let's create a program theory going back to our case study. So again, the objective is to increase colorectal cancer screening to 80% by 2018, and we'll add here specifically among the newly insured. You will start by stating the activity you are planning, such as, if we disseminate educational Facebook messaging targeting the newly insured, then the target audience learns that there are several colorectal cancer screening options available, and most health insurance covers these preventive tests. This also serves as the communication objective, which specifies the changes in awareness, knowledge, perceptions, beliefs, and confidence or self-efficacy of risk factors, diseases, or behaviors that your campaign hopes to change. In theory, this newly acquired knowledge will prompt your target audience to talk to their loved ones and doctors about getting screened. Then you hope the target audience receives the appropriate recommended screening. This is also called the behavioral objective, which specifies the changes in your audience's behaviors that result from your campaign. Then, in theory, the colorectal cancer screening rates increase in your region. Finally, the hope is that colorectal cancer incidence and mortality decrease in your region as well. This is also called the health objective, or the goal for changes in the audience's health status as a result of your communication campaign. As you can see, laying out your program theory really helps you think through the purpose and necessary activities of your social media campaign. It's also recommended to map your program or to create a logic model. So a logic model is a picture of your theory, or a drawing that shows how one thing leads to the next and illustrates the linkages between the if and then statements. So the following components are usually included in a logic model. First are the inputs, which are any resources or materials used by the program to provide its activities. For our case study, we would need to dedicate human resources and time. Second are the activities, which are any services or information provided by the program. For our case study, the activity would be creating and disseminating Facebook posts. The third is outputs, which is the amount of activity provided described in quantifiable terms. For our case study, this is the number of Facebook posts, impressions, and engagements. The rest of the logic model pertains to lists of expected outcomes of the program for participants. The first level of outcomes describes the short-term outcomes, or the communication objective, as we discussed earlier. For our case study, this would be to increase our target audience's knowledge about colorectal cancer screening, as well as to increase conversations about screening among family, friends, and practitioners. This can take the form of the number of people referred to an educational website and the number of comments and number of people tagged in posts. Intermediate outcomes usually refer to behavioral changes that follow. For our case study, this would be to increase doctor's appointments and increase colorectal cancer screening rates. Long-term outcomes refer to health outcomes. For our case study, this would be a decrease in colorectal cancer incidence and mortality rates due to earlier detection and treatment. So this is a very simple logic model, but you can make it as intricate or simple as needed depending on the needs of your program. Now that you have developed your logic model, this should help you start thinking about what outcomes and process issues you specifically want to measure as part of your program evaluation. Depending on the time and resources you have at your disposal, your program will need to identify the most important evaluation questions you want to ask. To decide what outcome measures you want to prioritize, you can ask yourself, which outcomes will be most useful in understanding program success and guiding improvement? Which outcomes are most important to the participants? And which outcomes are most important to our stakeholders, including our funders? To decide process outcome measures and what to prioritize within them, you can ask yourself, how much would it influence participant outcomes or satisfaction? How strongly does it concern staff members or other stakeholders? And how substantially would it help with planning or improvement decisions? So let's look at the logic model again to see what evaluation questions we should prioritize for our case study. In terms of outcome evaluation, increasing doctor's appointments and colorectal cancer screening rates would ultimately show the success of the campaign and may be a priority for funders, so we would definitely want to measure that. We may also want to assess whether we are able to stimulate increased conversation about screening among our target audience with their friends and family through the number of comments or tags on posts, as measuring increased knowledge directly may be challenging through social media analytics alone. Note here that analysis of the comments left on the post will be crucial to determine whether the comments were written encouraging others to get screened and spreading awareness. But if the comment is negative or if they express fear, for example, they should not be counted towards your campaign goal of increased conversation. So content analysis of the comments left on your social media campaign themselves would be crucial. In terms of process evaluations, we want to track the number of posts to assess what improvements can be made for the next program cycle, as well as number of impressions and engagement. Now that we have prioritized the questions we want answered as part of our evaluation, we can move on to designing the evaluation. Here, we need to consider the available budget as well as staff skills and capacity. Let's say for the case study, we have some budget allocated through grant writing or evaluating this social media campaign. And a couple of staff members have taken undergraduate courses in research methods, and others have taken on an online course on evidence-based communication campaigns. So with those resources, some metrics we might prioritize are the number of posts disseminated and number of impressions and engagement. This can be done pretty easily. Twitter has a free analytics platform for anyone to use. The tricky part is connecting your social media campaign with actual increase in colorectal cancer screening rates. Note here that communication campaigns alone cannot create the same change again. As I mentioned before, they would have to be integrated with other policy systems, environmental, and technological changes. But there are certainly ways we can track the impact of your social media campaign. For example, whether your social media campaign is responsible for driving traffic to websites, for making doctor's appointments, using web analytics, and tracking web links. So next, you will identify data collection instruments and then collect the data. So steps 4 and 5 of the NCCRT evaluation toolkit. To track the number of posts, impressions, and engagement, you go to your organization's Facebook page and simply click Insights. There, you will see basic analytics such as post reach, which measures the number of people who saw your post, and engagement, or the number of people that interacted with your post. These metrics are available for identifying how your posts encourage the posting or sharing by your audience members. If you find some posts are more popular than others, you can modify or increase the number of similar posts. For example, posts with photos often increase engagement compared to posts without photos. And also, if you have an action item, it also increases output and outcomes. So you can include an action item saying things like, visit this website to learn more, or share with 10 other friends to spread the word. And that can really help you increase engagement. And though we aren't focusing on Twitter for our hypothetical case study today, if you were to use Twitter for a social media campaign, make sure you go to twitter.analytics.com and activate analytics. It'll take about 24 hours or so for Twitter to start collecting data on activities for your Twitter account, and similar analytics that you saw will be made available to you. And most social media platforms make these analytics available to their users. As I mentioned earlier, more rigorous analysis will need to go into tallying the number of comments people leave on your social media message and the number of people that are tagged in a message. So this is a message from the Centers for Disease Control and Prevention, and it's not a colorectal cancer message, but it illustrates my point nicely. Although this Facebook post has logged 139 shares, this does not adequately measure the increased conversation, but it merely measures the reach or the viral spread. So to truly assess whether your Facebook post has increased conversation, you would need to conduct a content analysis of all of the comments people leave on your post. Unfortunately, since vaccinations have become controversial over the past few years, the comments left on posts like this are not always positive or accurate. There were 95 overall comments left on this post, but most of them are negative, fueling the controversy surrounding the HPV vaccination, so you should not count them towards your goal. However, a couple of comments, like the first one at the very top by Kathy, can be counted as increased conversation, as Kathy has tagged her friend Travis. She is telling him to look at this post. Therefore, in terms of metrics, you can tally the number of tags and positive messages that align with your goals, and this has to be done manually, as the computer can't really tell whether the content of a message is positive or negative. You can count them as real numbers or even as a percentage by dividing the number with the total number of comments. Cheryl?
Yeah, this is just another really important point. And as you mentioned, there's a lot of analytic data that's easily available and downloaded. And I think this is just a good example of knowing that sometimes the easy analytics doesn't get you the full information that you need. And in this case, it was really critical to align the measurement with the question that was being answered, which required taking that extra step beyond just counting the number of comments or shares. Obviously, this is extra work to do in an evaluation, but it was really a necessary step to make sure that the right thing was being counted. And I think that's just a piece that people need to think about with social media as well, that not all retweets or comments are created equal, and they may or may not be relevant to the thing that you're trying to count. So I think it's just a good example of sometimes needing to go a step beyond the analytics to really answer the question.
Exactly, very well put. So now let's apply what we've learned with our case study. So there are several ways to assess whether your social media messaging actually leads to an increase in colorectal cancer screening rates, and one of them is by using Google Analytics. Google Analytics is a free-to-use for any site that has less than 10 million users, which is a really high ceiling, and it gives you a comprehensive look at how much traffic your site is getting, general demographics of your users, such as location, what browser they were using, which pages they are visiting, what they're clicking on, and so much more. It's kind of scary. It can also tell you how your users are referred to your site, which is useful to identify whether your social media campaign was responsible for increased traffic to your campaign website. So how can Google Analytics, with our case study, be used to show increased appointments made for screenings? One way is to include a link that directs their target audience to a partner clinic's contact information, which will increase traffic to their website. You can also include a link that then takes them to a page with more information about colorectal cancer screening in general. For example, you can attach a campaign identifier to the link you include in your social media messaging. So as you can see, this little highlighted portion is a link in this GW Cancer Institute tweet. And this identifier will be specifically used to log the number of users who were referred to that site due to the social media campaign. This link was created using a link shortener so that a long web address can fit nicely in social media messaging, and this is especially pertinent for Twitter, which has a 140-character limit. And it's great so it's not an eyesore as well. Google Analytics can also be installed as widgets for websites, including social media platforms such as Facebook. So one example of a free URL shortener is Google's service. You enter the long link and convert it to a shortened link, and then you just simply paste the shortened link in the social media message. The Google URL shortener will log the number of clicks to the link for you. This is especially useful if you are including links to other organizations' sites in your social media messaging and you don't have the insights or control over their analytics. For example, if you are referring your target audience to a partner clinic's website, you can ask the clinic to share their Google Analytics with you, or you can use the Google URL shortener to track how many times your messaging referred people to the clinic's site. Other URL shorteners include Owly, Bitly, and TinyURL, and those are just some of them. And all of them are free to use to shorten links, but not all will have free analytics. So you can explore more on your own to see which fits your program the best. So at this point, I'd like to mention some limitations and solutions for social media evaluation. Note here that we are not able to track whether people who went to a clinic site thanks to your social media campaign actually made an appointment with a clinician, had a conversation with a clinician, or received screening. However, if you have a particularly close relationship with a clinic or association of clinicians, they may be willing to ask patients who come in how they learned about the colorectal cancer screening and conduct some tracking on your behalf. Also, many people think social media is free and underestimate the work, and this is not necessarily the case. As you saw in the logic model in the previous slides, social media maintenance takes human resources and time, and these can be significant loads. For example, if we want to achieve awareness raising about how reducing the consumption of processed red meats may reduce the risk of colorectal cancer, we might need to be mindful that we are up against companies like Oscar Mayer, a national meat and cold cut production company that employs hundreds of people at their corporate office for their social media initiatives. So we have a lot of competition in that sense. So yes, social media is more casual, fun, and an interactive platform, but it must be nurtured to truly maximize its potential. For programs that have allocated funding for their social media campaign, buying social media ads are a great way to reach audiences. For example, here is a social media Twitter homepage. You can pay to increase visibility of and promote a trend or a hashtag your campaign is using. This is really costly. So for example, you can see that Mission Impossible recently promoted their hashtag Mission Impossible. Again, this is costly, and it's a flat fee of $200,000 a day, which most of us do not have. But Twitter also offers promoted tweets and promoted accounts, which can cost anywhere between 50 cents and $4 per engagement. This is great because if you find that using social media is ineffective and people are not engaging with your message, the campaign would not have cost you very much. Similar ads can be bought in various other platforms, including Facebook, on the home page, in the news feed, and on the log in and out screen. And more rigorous evaluation is possible for social media, as with any communication campaign. You can conduct pre- and post-campaign focus groups to see if there were any changes in awareness or knowledge. You can assess for changes with surveys or interviews, including random digit dialing or mall intercept surveys and interviews to see if they recognize or have heard of the campaign. Or you can conduct case studies to capture unique experiences of certain individuals and their families, friends, and providers for more qualitative information. Collecting the data only gets you so far. Analyzing and interpreting the data and drawing meaningful conclusions is key to measuring success and identifying strategies to improve your campaign in the future. Drawing conclusions involves stepping back to consider what the results mean and what they imply about your work. During this phase, you can ask yourself, what patterns and themes emerge from these results? For example, you may find that people click on a link you provided more if you include images or infographics in your social media messaging. Are any findings surprising? If so, how do you explain these results? For example, you may find that tweets you post in the early morning and late evening have higher engagement rates. Why? You may explain this by thinking about the general schedule of the adult audience you are trying to reach. Maybe they are looking at social media to catch up on the news and updates after they wake up and right before they go to sleep. Do any interesting stories emerge from these results? One advantage of having social media and using it is that it allows for engagement with the audience. Perhaps someone responds to your tweet by saying, I heard colorectal cancer screening hurts, or I don't think my insurance actually covers this test. And this gives you the opportunity to respond and debunk myths and seize the educational opportunity. Over time, you may learn that your audience's level of knowledge, attitudes, and beliefs about colorectal cancer screening that you never knew before. Once you have obtained your evaluation results, you should share findings with your key audiences and stakeholders to inform the public, make health information meaningful, and translate research into action. Other programs may be looking to learn from you, whether they may be factors to replicate or factors to avoid. Evaluation findings should also be used to enhance your own programming. Consider the following suggestions when making programmatic decisions based on your evaluation findings. Set goals for process and outcomes to help you gauge your success in meeting outcomes and help you prioritize program improvement efforts. Review other communication programs or evaluation studies and integrate their best practices into your program. Consider both short and long-term program improvement strategies. For example, a short-term strategy to improve your campaign may be to increase the number of social media posts that include images and infographics, as you found that that is a great way to increase engagement. A long-term strategy may be to expand your network and partnership with clinics in your region that are willing to work with you, to which you can refer your audience for screenings and that are willing to participate in helping you evaluate your program. So after this whirlwind of how to sort of evaluate your social media campaigns, where should you go to get started? There are plenty of resources out there to help you get started. The Technical Assistance Portal at the cancercontroltap.org is a website dedicated to coordinating and communicating technical assistance available to comprehensive cancer control professionals. We have a searchable and filterable repository of resources produced not only by the GW Cancer Institute, but also by the Comprehensive Cancer Control National Partners, Cancer Control Coalitions, and other stakeholders. For social media specific resources, go to this link, tinyurl.com/cancer control communications. Our repository also includes social media toolkits for specific awareness months created by the GW Cancer Institute. These toolkits are designed to help public health professionals understand the functions and benefits of social media, establish an awareness month social media strategy, manage social media accounts, implement Facebook and Twitter best practices, disseminate awareness messaging, and evaluate their social media efforts. You are also more than welcome to retweet the GW Cancer Institute's messages or tweet them as your own. I hope this presentation has given you a better understanding of what social media is, what role it can play in the public health field, ways social media efforts can be measured, and what resources exist currently to help you get started on your social media strategy. But my advice would be to just dive in and get started. Although you don't want a social media account to just sit there, which is oftentimes worse for your organization's brand than not having one at all, it's reasonable to create a personal account and get a feel for the culture of what social media is, what people seem to respond well to, what acronyms mean, and what hashtags are useful and not useful. If you find difficulty, please feel free to reach out. The GW Cancer Institute is funded by the CDC to provide technical assistance and training opportunities to support National Comprehensive Cancer Control Program grantees and their partners. Here are some friendly faces of the technical assistance team, so please feel free to reach out to us. And here is my contact information. If you have any feedback or questions, please feel free to reach out to me.
Thanks so much, Kanako, for that. And I think, Cheryl, you may want to add a few tips on our social media efforts as well.
Yeah, to close, we're just going to talk about a few overall tips for evaluating social media efforts. Many of these you'll also see kind of resonated in Kanako's presentation as well, but some general things to think about if you will be implementing social media efforts as part of your program strategy. First, make sure you understand your target population's use of social media. And, Kanako had a nice slide showing some of the data about who's using different platforms. Obviously, that's information that changes pretty rapidly with, new systems and new platforms coming out and changes in how different demographics are using them. You need to take some time up front to understand how the population you are trying to reach uses social media, not just what platforms are they on, but how do they use social media in general and as it relates to accessing and using health information. When are they likely to use it? Kanako also mentioned the timing issue, and I think that's important, and there is some research from other types of public health efforts showing that being very strategic around the time of day that you're posting your messages is important. If you're posting a lot of great content at a time when nobody is going to see it, social media changes so quickly and people may not see something that was posted in the middle of the day if they're looking in the evenings. There's a growing body of research around social media and how it relates to various health and public health efforts, and it's worth taking a little bit of time to really make sure that your strategy aligns with the population that you're trying to reach. If you have questions that you can't easily answer through some of the existing research, you could even convene a group of people within your target population, have a focus group, or do some one-on-one interviews with people to get a better sense of how they are responding to health-related information that they may be seeing online. Second, be very clear about your social media goals. We already talked a little bit about this, but you need to be very clear about what you're trying to accomplish or gather through social media channels. It's a good idea before you proceed to make a list of what you're trying to achieve from your social media efforts. Social media can serve a variety of different purposes, from sharing information to answering questions to community engagement. Before you start developing the content or thinking about the evaluation, be very clear about what you're trying to accomplish. What do you hope people will do with the content you produce? What do you want them to learn or to think about, and what kind of action do you want them to take? The more you're clear about the goals, the more you can align that with your content as well as with your actual evaluation. Third, gather input when needed to shape your social media content. There is, obviously, Conoco just talked about the toolkits that they've made available. There's other information through the roundtable regarding the effectiveness of various communications messaging around colorectal cancer screening. You want to make sure that the content is sound and it's going to be engaging and effective. If the existing communications materials out there don't work and you're developing your own content, it's worth the time to gather input from people about the message. Test your messages with a small group representing your target population, for example, and use that input to make sure that the messaging is understandable, that it's engaging, it's interesting, and it's effective. The fourth tip is to match the metrics to your goals. There's a lot of different information that's available, and you need to make sure, as we illustrated in Conoco's example, you need to make sure that you're measuring the right thing. For example, if you're trying to measure engagement, then what does that look like in the platform that you're using? Is it retweeting or reposting? Is it the number of people who have replied or commented? The number of people who have clicked on a particular website? If you're trying to increase awareness of an issue, you might be looking for things like increases in the number of people who read information or have access to information, while engagement may involve documenting things like people who retweeting or sharing information or commenting or replying. If you're trying to drive people to other content, such as directing traffic to a website, then you'll be wanting to look at things like URL shares and tracking what do people actually do when they've reached your website. How long do they stay? Where do they go? Next slide, please. A few more last tips. Use the right monitoring tool. There's many different analytic platforms out there. Conoco mentioned several that are widely available if you're using things such as Twitter or Facebook. There are some social media analytics systems available through each of the most common social media platforms. There's others that are available through third-party systems. Some are free, some are not. If you're not sure what the right tool is for what you're trying to track, certainly you can just do a quick Google search, and there's lots of options out there. I also included a link in there for dir.com for social directory. And if you click on that, it's just a directory of lots of different systems. It takes a little while to go through it. There's a lot of information there, but it includes information on more than 300 different social media metrics tools that are available, and you can be looking through that system as well. You'll want to figure out the monitoring tool in advance and be tracking it as you go, and that's a really important piece of selecting and that tool. This isn't something that's easy to do after the fact. Many of the different analytics track information in real time, and it's easier to track it as you go. Some don't have historical data. If they do, it may be expensive to try to get. So you'll want to take the time up front to figure out what the right tool is and embed it in your strategy. 6, document your baseline. Again, the historical information can be challenging to get later. If you're looking at things like how many people like a page or how many people have had exposure to a message that you're producing, take the time and get your baseline. What is the thing you're hoping to see change over time, and can you document what it was like before you launched the new content or new approach? 7, focus on your most important numbers. Social media, with the growth in social media and then just knowing how many different platforms there are to use and how many different analytic systems there are to use, it can be easy to get distracted by all of the available information. Be sure to highlight what are the most important numbers that you need and include the benchmarks or context so that people will understand what the figures mean and try not to get distracted by some of the other information that may be available. And then finally, use the data to make real-time adjustments. Your use of data for this type of initiative can reflect the dynamic nature of social media. This is not the type of evaluation where you launch an initiative and then wait several months to find out whether or not it worked. You get pretty real-time information. Kanako displayed some of that on one of her slides. You can be looking at you as you go about which of your posts or which of your content messages had the most return on investment, which are the ones that seem to engage people. What are the things that people seemed most likely to share with others or to like or to comment on. And as you go, you can use that information to continually refine your messaging so that you don't need to wait to find out at the end how it all worked. You can go make adjustments as you go. The toolkit, again, will have some additional information about all of these various resources and tips and strategies, but those are some of the main highlights for now. And I think that's it. Tamar?
Yeah, that's great. Thanks so much, Cheryl and Kanako, for those amazing presentations. I'm certainly learning a lot, and I'm getting very inspired to develop a new social media campaign. We just wanted to address everyone's questions, and we do have one for you, Kanako. It is about the social media market share slide. Do you know if there's updated information? We covered kind of the past 5 years, but do you know if there's more updated information or how and when people can access that kind of real-time information on market share?
Yeah, so I referenced Pew Research Center throughout my slides, and they do a fantastic job doing regular internet and social media-based analysis. They do geographic analyses, they do age analyses, so depending on the specific audience that you're looking for, you can dive in more into the data that they provide. I would also look into the point person at Pew Research Center. Lenhart is her last name. She does some great research and has published a lot of journal articles based on social media reach. So those two will be the two places I recommend people to look into for more information.
Great, thank you so much. And then Mary Doroshik, I think this question might be for you about the messages that we talked about doing the market testing in terms of what messages might be most effective in getting people reaching that 80% by 18 goal. Can you share with us some of the messages that came out as possibly the most effective?
Sure. So across all our key target audiences, the newly insured, as Kanako has been referencing, the African Americans, Hispanics, and the insured unworried well, and the financially underserved. 3 messages were all resonated the highest with folks. The first was that there are several screening options available, including simple take-home testing options. Talk to your doctor about getting screened. The second was that colon cancer is the second leading cause of cancer deaths in the U.S. when men and women are combined, yet it can be prevented or detected at an early stage. And the third one, which I think most aligned with Kanako's example, is preventing colon cancer. Finding it early doesn't have to be expensive. There are simple, affordable tests available. Get screened. Call your doctor today. And I think the great things about these messages that these were just testing words and seeing how the unscreened responded to these messages, but adding creativity, reaching at them through creative channels such as Kanako described, I think really is a nice way to get our messages across and really start to sway these targeted audiences.
That's great, and we can find people can find those in the guide, the communications guide that is on the Roundtable website now.
That's right.
Great. Okay, well, we do want to respect people's time, and so we can wrap up for this webinar, but if you have more questions, feel free to send them to Mary Doroshank, and she will get them to the right person, and we will get those answers and responses to you. We just want to thank, again, today's experts, Cheryl Holm-Hansen and Kaneko Kashima, as well as Wilder Research and the GW University Cancer Institute. I want to thank my co-chair, Andy Dwyer, and the Roundtable's Evidence-Based Education Outreach Task Group for their expertise and hard work. To Mary Doroshank, Dion Christopher, and Emily Bell at the ACS, thank you. And of course, the CDC for their support in making this webinar possible. And thank you again to all of you for joining us. Please mark your calendars for our next Roundtable webinars on colon cancer screening. These are coming up on August 17th, Improving Community Health Center Patients' Access to Specialists. September 10th, what health plans can do to achieve 80% by 18, and then the evaluation one on September 21st on evaluating systems changes in colon cancer screening. We really appreciate you all joining us, and thank you so much.